You're an incredible doctor, just like all the doctors on HealthTap. It's important to not forget the importance of the bedside manner, just as you would in the office. As a doctor, some important things to keep in mind in regards to your body language as you're having a virtual consult: greet the patient, introduce yourself, give them a warm smile, let them feel at ease, have a delightful relationship with your patient and engage them and gain their trust in your care. When you're doing your virtual consult, you will be taking notes as you do in the office. You may need to divert your eyes to the computer screen to be writing your notes, but do tell the patient, let them know what you're doing. Always keep the communication open. It's really important for them to know that you're listening. If you feel that your patient is feeling uncomfortable in being in the video conference with you, the patients do have the option of turning the video portion off, and please do remind them if you sense that they're uncomfortable. They can continue their conversation with you both in voice and in text, which can be very helpful as well. During your virtual consult on HealthTap, you will have access to all of the patient's provided medical notes, any information that they've provided on their history, on their medication usage, on allergies. And what's exciting is you also have access to other consults that they did with other physicians. So you have basically a past medical history within HealthTap, and that will help you provide better care. The private health information that the patients are providing are absolutely secure. It's only accessible to the patient and the doctor that they're consulting with. As you do in your office, you should always remember to review the patient's past medical history to help make good decisions on your plan. If a patient is asking for a medication you think is not appropriate, as you do in the office, explain to them that your primary goal is to keep them safe. Studies show that when patients are informed, they make better choices for themselves. So do take the time to educate your patient. Always remember to write a SOAP note at the end of the virtual consult. This becomes part of the patient's medical record, and it also becomes part of yours. So make sure that you provide your SOAP note. In the virtual practice, it's very much the same. During your assessment, use the health information that was provided by the patient and also your own assessment in order to create a diagnosis and then ultimately your plan for the patient. There are 3 types of plans that you can include in your virtual consult with your patients. You can e-prescribe a medication to the patient's local pharmacy. You can also refer to a specific specialist on HealthTap. You can also create a checklist for the patient, give them action items to do, and remind them to be healthy and feel good. If the patient is presenting with symptoms that require urgent care, please advise the patient to contact emergency services and do advise HealthTap of what has happened. If the patient is being inappropriate, please be assured that you may end the conversation. You may end the consult immediately, and please leave us feedback. You certainly can call, email, we're here for you. Please let us know if you have any negative experiences. As a HealthTap provider, you can prescribe medication for your patients as appropriate. However, do keep in mind that there are several categories of medications that you're unable to prescribe. First are DEA-controlled substances, Schedule 1 through 4, as well as medications for psychiatric illness and also lifestyle-type medications such as medicines for erectile dysfunction and diet medication. During your virtual consult, there may be a time when a family member asks questions regarding another family member whose note is not attached to the visit. Please remind them to create a new virtual visit with the other patient so that you can document appropriately and have an appropriate SOAP note that's specific to the other family member.